Hello parents, this is Dr. J.K. Reddy talking from Don Bosco Studios. Being a parent and a pediatrician, there have been thousands of questions going on in our brains that the schools are going to be open to all the children soon. So what is going to be new is a big question. I know some children are happy, some children are anxious, the same with the parents. Some parents are very happy to send their school, some parents are really worried what is going to be there. We know anything new or anything going to be in a change, we will surely have that anxiousness. That anxiousness must not lead into a complicated worrying sort of things. So I am here to help you out and tell some of the things what to take care before you send your children to school, because the school alone, administration alone can't get everything under control. So we as a parents, because I am also a parent of Don Bosco, so the other way around, we as a parents and the school and the children all together only can handle this back to school situation. So let me put you some of the questions what the parents who visits me frequently ask these questions. So first question is, do we really need to send our child to school? That is the biggest question they ask. So let me answer this. Sending to school is not just learning. There are so much more to do in school. See, the definition of health is not merely absence of disease, social and mental well-being. This is by WHO. Definition of health is not merely absence of disease, socially and mentally we must be fit, then it is called health. So we all sitting inside the house, getting away from the virus, thinking that we are healthy. No, socially, mentally, physically we must be fit. That comes only when the child starts getting exposed to the other age group children and to their friends. That is very important, because I as a pediatrician see a lot of children are in stress, are getting addicted to gadgets, and even obesity is becoming a big problem. So these are all things to be kept in mind when we are sending our children to school. Why we want the child to go to the school is one thought I want, what from my side I want you to do. So it is not merely absence of disease, we want our child to be mentally, physically and socially fit. So this important point I want you to take in. So this is one question, whether is it dangerous to send to school? So the dangerous word is one thing which is again bothering me and everyone, that even the children get worried. My parents were asking, it is dangerous to go to school. Nothing is dangerous. So what precautions we are taking, how we are protecting ourselves, that is more important, because COVID will not disappear in the near future, it will stay for some time. So getting it control is very important. So as a parent and as a doctor, I request you people to follow some of the rules and regulations and let the child also be explained, not been commanded or been scared of. So you must not scare them that if the child is getting, if you touch someone, COVID will come, then you will get into sickness. Then this thought must not be there, because first wave, whenever the child visited our hospital, he was acting as if there is something around everywhere. If you touch something, the whole world will come into a stop. That is how the children were behaving. Why means because the child were put into this mode, that someone touches you, someone you faultily touches the lift, then you are going to get into trouble. So that is not to be worried, because now been 20 months we had seen that COVID can be controlled just with a mask, hand sanitizer and social distance. So that is one thing I want the parents to understand. So don't put this into the children's mind and send them. Tell the children you are going to school to meet your friends, to meet your teachers, to spend some good time in school. That is what I want the parents to be doing this one. Next, so how to prepare them? So we can't just like that, now children are getting up afternoon 1 o'clock, or they are getting just before half an hour before the class. So these and all things must be again streamlined. because I am having the children who are about a 9th class, 10th class, who started already coming to school, coming with headaches, sleepless nights, then other symptoms they are complaining, because suddenly their pattern is changed. So I want you to prepare your children to school. So back to school preparation also is important. So on time bed, getting up on time, this is important, and preparing them to go to school. That means make them feel happy. Don't scare them up, because we don't know which child has what exposure in the house or how much of studies they have done. So we are sending the children to school only to meet their friends, meet their teachers, and have a social environment. This is what you must think for the first 1 or 2 weeks. Even the father Don Vasco, he was saying this, that I am not going to give homework for the few days of schooling, because I want the children to settle down. That was a nice thing to hear from them, because they want the children to interact, they want to spend time with the other this one. Only thing we have to now teach them is how to maintain social distance, how to wear the mask, where to use the sanitizer. These are things what we have to tell. So I know it is very difficult for us to wear the mask. As a doctor, I am wearing for 12 hours, 14 hours a mask. I know it is really difficult. So it will be difficult for the children too. So how to do it? So you must slowly explain them the need, and you must always give them an extra mask. Sometimes the mask may fall off and it are missed somewhere, then they get panicked that they don't have a mask. So always put one more mask in the school bag. That is one thing. And using sanitizer, they must not get obsessed with the sanitizer also, because I had children who had skin reactions or too much of inhalation must not be there. So you must always explain them how to do it, and some method of social distancing. So it is very difficult when you meet a friend. It is very difficult without saying hi to them, high five to them. So maybe something new, innovative you must make. So I saw some place where they were just opening their hands and saying hi. So this was a real nice funny thing to do. Maybe whenever the two children meet, we can tell them, do like this, say hi, like you open up like a hug and say like this one. So it was nice. The next thing, the most important thing is the break, school break. So during the break, that is the time where children want to meet all their friends and all. So that is where we have to be little careful. So we have to slowly explain them and try to give them the method of controlling the COVID. So it is not that COVID will not come at all to the schools, or there may be a flare up also tomorrow. So what we must do is not to worry. The worrying part I had seen, the second wave, a lot of people got worried. That itself has may cause a lot of problems in the families. So we will see what happens. See, we had opened up all the centers, everything we had opened up except for the schools, and we think that the schools alone will prevent the COVID. Is not the thing. So we have to send them to school with all the protections, and I want the parents also to get vaccinated. So we always ask, the school is vaccinated. Yes, yesterday the father was saying the whole school is vaccinated, the staff are vaccinated. So this is a nice thing. But from the parent side, what? Did we all get vaccinated? Did our driver get vaccinated? Did our auto driver get vaccinated? Make sure the people around you get vaccinated, because that is also is going to be make a big this one. From there, what I want to do is, the children falling sick will not have any major problems. Touch wood, so far I had seen about 200, 300 children, all are doing very well. So COVID during the children side, there is not making a problem. Only thing is they can take it home and give to other elders in the house. So make sure all the elders also are vaccinated. The vaccine for children, that is a question again now. It is on the move. So surely it will be there. So as the government approves, then we can plan out for all those children. Next thing, other than COVID, what I want you to worry. So one is obesity. Because of the last 20 months, a lot of children are put on too much of weight. So we have to plan how to get on this. And I don't want the parents or the PT teacher to stress upon too much of physical activity at a time, because all these days we were not doing the routines. So slowly it will take some time. So I know it will, as gradually we have to increase the activity. There are school activities which the father had told me other day. There are 3-4 activities, nice physical activities he has shown. And I am also happy if there is more open ground activities, because that is a place where the children are in a social distance and they can even spend more quality time. So that is one point I want you to think over. And parents gathering at the school gate to receive the children. So that is one important thing I want you to don't spend too much time gathering at the gate. Try to pick your children on time and come on time and pick them up, so that there won't be much of crowding there. That is the thing. And if any one of your family members or the child is having fever, cold, please stay back so that the spread of disease can be prevented. So even you can train the children. Even I say that before coming to school, the children can have a thermometer in their this one. They can a bigger child can even check the temperature. If the temperature is below 100, then they may 99 or something like that, they can come back. So teaching the children to examine themselves is an important thing. So what I want the parents to think is, school is a good thing to send, but with all the precautions, and not to panic the child, keep them in a positive side, and always teach them the basic things how to prevent COVID. See, simple, when you have a viral attack in a software company, we are not going to close down the software company. We are going to give methods how to safeguard the gadgets or safeguard the company within this one. The same thing we have all this here. So shutting down the school will not give us this one, because I want for other things. For younger children I am seeing speech delay, I am seeing poor eye contact, I am seeing. So all these things again is adding up to our burden. We are just thinking COVID alone, but I am coming across a lot of other things. There are now we have a lot of information like autism, autistic futures, this one, development delay. All these things are increasing. I feel because the children are not getting exposed to the same age group children, and we are in our own world. This is all happening. So I want the children, younger children also to come to school, meet their age group children, spend time with them, interact with them. Then we must diagnose them as autism, autistic delay or speech delay. All these things are not. See, most of our children are autistic mimics. That means we are not teaching them and we are blaming that they are not doing it. As a parent, after 1 year, we have to teach our children how to talk, how to interact, how to socialize. We don't teach them anything. We think the child automatically will learn, will not learn. We are all in our own world with our gadgets, and the children are not able to interact. Before the schools were there, the children used to learn from the surroundings. Now they are not there. So when we get an opportunity now, we don't know how many days the schools will run or what will happen to the COVID next. So this is all a question to be answered. So for now, I want all the parents to take this opportunity, put your children back to school, teach them the basic preventive methods, identify a child when they are sick, stay back home, give them a positive this one, and always tell them they fall sick also, there is no problem. They have some children who are so much worried that they will be isolated, they will be kept in a room if they become COVID positive. These are all not there. Now it is not that the whole family, we can stay together, we can use the mask. I am seeing every day when I get into the COVID ward, when I wear all the gadgets, we are safe. So these thoughts must not be there, because children may have a nightmare if they are going on thinking that if I get COVID, what will happen, all those things. So always keep in mind that children are like us, they are also having the same mindset as us. So we must make them have their routine life. Even this, they must enjoy their school life. And teachers here are to help them. So always tell the positive side to the children. Anything is there, you can express to your teachers, interact with your friends, you can show your talents in school. This is what we have to put forward. So keep them positive and keep it always positive. Everything is possible, and tell everything is good. So then only the children will. If you tell it is compulsory, the child may not like it. But if you tell why it is, what it is importance and why it is good, then children surely will understand. So keep explaining them, keep talking to them, have a great interaction with your children. So you will grow longer and happier. Thank you. Thank you, friends. Thank you, parents. Thank you, Don Bosco, for calling me to talk on this topic. I am really happy, and I am there available at Apollo. Anytime you can contact me if anything more you want. Thank you. Thank you, Don Bosco team.